Hello, Pascal, and welcome to this webinar series of the ICO that we run every now and again. And then Pascal, he's from Belgium, but he lives in Canada. And he's a senior osteopathic practitioner and studied osteopathic medicine for 9 years. I was impressed with that detail. He gained 2 degrees in osteopathy and a doctorate thesis in the Department of Neurosurgery in the University Hospital in Lausanne, in Switzerland. He's a pioneer in evidence-based osteopathy, and he runs different research projects, as he's going to talk today, in the field of neuroscience and osteopathy. And he also does research in neuroimmunology and non-invasive vagus nerve stimulation. He was a guest speaker to the ICO conference 3 years ago in London, and he's been teaching all around the world. I know he comes to Spain and other areas in Europe. So I'm very pleased to welcome you and to listen to you. Pascal, all yours. Thank you.
All right, thank you, Diego, and thank you for this opportunity again, and welcome everybody who are joining this talk. It's not a very academic presentation about techniques or whatever, so no, I think that I was interested to talk to you guys about the review. It's actually a review we did last year. We finished it last December, sent for publication in review end of 2020. It was a paper. They talk about the general osteopathic treatment, so traditional osteopathy, and we want to. We were excited to write this kind of review, talking about the GOT. What actually is the general osteopathic treatment? As Wernham said, you name it, whatever you want. Body adjustment, total body adjustment, whatever. The GOT is very well known as an acronym for General Osteopathic Treatment. In French, it's TOG. So we targeted the Journal of the American Osteopathic Association and the Journal of American Academy of Osteopathy. So it was accepted by the Journal of American Academy of Osteopathy, and it will be published soon. So the title is was Traditional Osteopathy and the General Osteopathic Treatment, an historical concept, and what about modern application. So we were 3 writers on this article, Tim Sparrow, Francois Lalonde from Quebec, also osteopath PhD, and myself. So the purpose of this article was to review a bit the history of what is the general osteopathic treatment, where it came from, how it was spread, what's the principle behind this, and how it is used and recognized, mostly actually in the United States, because it came from that. But the problem is that you know, the general osteopathic treatment is not part of the American Association of College of Osteopathic Medicine glossary of the osteopathic terminology. It is not. So they have a lot of osteopathic manipulative medicine defined, you know, as the application of osteopathic philosophy, sure, structural diagnosis makes sense, and the use of the osteopathic manual treatment in the diagnosis and the management of a patient presenting somatic dysfunction, right? So we know that osteopathic manipulative treatment and techniques are commonly used to treat patient somatic dysfunction, classically related to musculoskeletal disorder. And the criteria to assess those somatic dysfunctions relate to the TART principle, so which is for texture, abnormality, asymmetry, restriction, and of motion and tenderness. And this TART is well accepted in the profession for the assessing principle of this somatic dysfunction. But osteopathy is more representative than the treatment of somatic dysfunction. You know, indeed, osteopathy was previously, still is, somewhere described as a science, an art, and a means to convert physical action into its physiological equivalent. So for those trained classical osteopath, you know about that, it makes sense. And this was shown not because of Wernham. This one shown in several studies from the past and from now. We can refer to a study from Castillo and Ferris Swift in 1934, where they assessed the splenic, stimulation on cells and antibody content of the bloodstream in acute infection disease. And so relate to osteopathic treatment, maneuver, whatever it was, but they show the effect on this spleen technique, so the splenic pump, because the spleen is a key organ in regulating our immune system. So at that time, they show evidence of osteopathic manipulation technique and principle, physical, so the physical action converted into its physiological equivalent, right? So this is not new, and there are some other recent study that they show that, right? And I believe Mervyn Wallman was talking about also several articles published in the British Medical Journal about that. So we know that osteopathic technique used more commonly, include the high velocity, low amplitude HVLA thrust, muscles energy, strain, counter strain, articulatory techniques, lymphatic techniques, and so on and so on, but the GOT, which is not new, is not very well, was, let's say, abundant in the US. We will talk about it a bit later, was totally abundant. So although it's a very premier, it's a very original osteopathic treatment, it was abundant in the US. So those techniques that we use, like that direct or indirect, such as specific adjustment technique from Thomas Dömer, and the general osteopathic treatment, the body adjustment, which was luckily preserved and enriched by Joe Wernham, you know, are presently not listed in this glossary. And this is for us, this is something that needs to be reversed. So it was about this, the objective of this article is to update the Americans about, I mean, the original treatment, osteopathic treatment, that include the general osteopathic treatment, right? So we know that the osteopathic education since still are more generally based on still view of practicing osteopathy rather than Little John philosophy and of practicing osteopathy. It was not much that there was a very big fight against both guys. It was very political, like Chris Campbell explained it very well in his book that you can refer after after this webinar, because it's a very essential book to understand what's happened and also what driven osteopathy from the US to Europe. And I mean, the origin of the general osteopathic treatment is not from Little John. The GOT still already exists at this time of Still before Little John, but it was done before any specific application. And in 1906, Carl Philip McConnell, American osteopath, he described the general treatment as consisting of passive and active motion using rotation, flexion, extension, but also soft tissue massage or stretching, along with application of heat, cold, pressure, whatever, you know, and some specific treatment like readjustment of body part and removal of obstruction. And it was very famous at that time. Another osteopath in 1922 in the States, Mary Leclerc, MD and DO, was very partisan of the general treatment because it contains the diagnosis, it contains all general maneuvers and specific correction, including relaxation. So she believed that using this treatment can be very beneficial for the patient and should be used, right? And although maybe we don't know the exact sequences as we know now with the very, let's say, Catholic procedure of the body adjustments, you know, perfect routine, perfect rhythm and rotation, and all these sequences of movement that, you know, maybe it was not given like that, but the principle at the time remained the same. And McConnell, who might have been the first to write about the GOT before Little John, he said that you can use it on certain conditions like constitutional disease, you know, malformation or pathologies that are driven by significant genetic origin, or anemic case, or where the underlying disease process are still to be determined. And I remember that Mervyn Wallman gave the same notification as well. It doesn't mean that we have to use the GOT all the time, but we have indication of using it, and we have contraindication of using it. And the problem that may happen in the States, and why they were not simply teach it, is because they noticed that at that time, maybe because of the ignorance of many osteopaths, right, they tend to use the general osteopathic treatment in every case presented, right? And so the fact that because of that, he didn't become very popular, and he was quite abundant until of course Little John came here in 1934, and through the awareness, the publication, the extensive publication of John Wernham, the GOT survived, right, and came here in through Europe. And Wallman point out that the term general for the body, for the general osteopathic treatment, doesn't mean vague or imprecise. It's very accurate and needs specificity and focus, right? It's just the idea of the whole body is to attend to one articular mechanism. And actually, it fits well with Little John, you know, considering the three pillar foundation for health, which mean the structure adjustment, the function adjustment, and the adjustment of the organism to the environment. And actually, that's all we classical osteopaths very well understand it, right? And of course, the GOT, like early in the States, of course, they may include specific adjustment, right, along its course. And to specifically balance these three pillars all together, you know, adjustment of the structure with the spine and the limbs, you know, through the general treatment and through specific treatment with long lever techniques, right? This is very, very common to this treatment. And adjustment of the function, workings on the lungs, the digestive and assimilative organs, right? Through the osteopathic center, which needs to be known and very also critical to understand the correlation between our physical part and the physiological response, you know? So if still paid more emphasis on the structure and Little John more on the physiological aspect relate to the osteopathic lesion and treatment that Wernham based is model, right? The biomechanical model on the first pillar, right? So adjustment of the structure that make that link between our body structure and the function. And that's what he called, as we know, the body adjustment or the term, right? But Wernham always said that, I mean, as a classical osteopathic treatment, so classical, it's more related to a time in the history. We had the original time of still Little John, then after the classical time with Little John coming here in the UK, Wernham, and then now we are on the modern side of osteopathy. But anyway, this treatment remained original, it remained classical, and is still modern, right? So it's not something that it's old and it's brought forward with all osteopath, Little John and so on. No, it's just a continuation of the same philosophy, and you know, Wernham did it well, and it was highlighted as well when Core came in 1996, you know, and he addressed the British osteopathy at the time, and he said that you don't treat a muscular system, you treat person. So you treating more than a musculoskeletal system. And this is a trap, could be a trap for the GOT, could be a trap because the GOT, you know, as a routine, could be annoying, you know, and people might think that we use this to prepare the body for other adjustment, I don't know, right? But this is not what it is, you know? It's just the application of physical treatment all over the body, cranium included, to convert physical action into its physiological equivalent, right? And I mean, this is just that. And of course, we have the long lever technique, we have the gentle passive rhythmic technique, we have the oscillation, you know, spinal mobilization, pumping action, and all of this as an indication is done for something, right? And we know that all of this action will be converted in a physiological equivalent, right? That's what it is. So even though the GOT approach is a unique biomechanical model as its foundation based on the first pillar, as we said, right? So this model also addressed the nature and distribution of gravity that run through the body in all those planes and its influence upon posture. And so the structural and the functional activity of the regional and combined curve and arches of the spine are used as a mean to act on the whole body person, right? So, and the physiological effect is just awesome and multiple, targeting all the body physiology, the nervous system, the vascular system, the fascia, all the tissue are concerned, right? And in 2015, it was a study from ComAir studying the GOT and try to provide evidence of all the treatment, this treatment approach can address disturbance imbalance. So, and they have some good results. But at the end, it's just, you know, an example or a significant change in posture can be noted after GOT procedure, especially in this study on elderly people. And you know what, as I use it every day, I mean, mostly every day, I always put my patient back against the wall before the treatment. And then after the treatment, I put my patient back behind the wall again. And it's very interesting and amazing how the patient just 20 minutes of treatment, they just feel that, notified that the posture is better, is more comfortable, the tension are removed, right? And this is one of the big strength of using the GOT, right? When it is well done. And so the GOT, like taught by the Institute of Classical Osteopathy and promoted like this, is the way it should be, right? And so a review of the use of the GOT in UK, in France, Australia, whatever, and soon maybe, hopefully, in the States, and or in North America might be interesting, right? Because we know that rhythmic mobilization procedure, right? Like spinal oscillation or other one, have been shown to stimulate the intrafacial mechanoreceptor of the tissue involved, right? So leading to altered proprioceptive input in the CNS. And therefore, you know, acting on the tonus regulation associated with this tissue. So the early osteopaths, they used this kind of articular and non-articular approach, consisting on long and short lever, whatever manipulation, you know, including stimulation, inhibition. You know, because they had a good understanding of the physiology, I guess, right? And it worked, and they had results, and they published the results, right? We know as well that the GOT can impact heart rate variability. So the sympathovagal balance, right? As compared to standard OMT procedure, like balanced ligamentous or membranous technique. And so it was reported that indeed GOT influenced heart rate variability and the autonomic nervous system activity, consequently increasing the parasympathetic, so vagal tone in this case, and decreasing the sympathetic one. And we know that high heart rate variability is synonym of health, and a low heart rate variability is more towards disease, right? Whatever the disease is always the same. Also, it was shown that it improved patients suffering with fibromyalgia, right? And also that gentle soft tissue technique, like we do when we do body adjustment, those soft tissue techniques will stimulate low mechanical pressure action on low intensity C tactile afferent fibers, you know, and we know that those C tactile afferent fibers stimulate the nucleus of the tractus solitari because by the release of oxytocin from the hypothalamus to target the nucleus of tractus solitari. And so therefore, a gentle soft tissue technique that we use can initiate neuroendocrine immune response, right? So this was shown, this was proven. And if, of course, and that's why you have to watch the demonstration of Waldman if you are not yet a student of the ICO, because it's just wonderful, because what it does stimulate of what I just said now. Okay, so we know also that some studies have shown that the general osteopathic treatment has an effect on anxiety. But why? Well, same, because at the end, it will activate neuroendocrine immunological response and stimulate the vagus nerve, right? The vagus nerve, there is no specific technique, to stimulate the vagus nerve straight. We don't know, I don't remember any publication about that, but we know that we can stimulate the vagus nerve through the peripheral nervous system. Whatever the upper limb, whatever the lower limb, we know that we stimulate the sciatic nerve, it will stimulate the vagus nerve. We know that if you stimulate peripheral nerve from the cervical brachial plexus will stimulate the vagus nerve. And we use all those limbs in the GOT. So therefore, don't be surprised that GOT can have an effect on anxiety, right? And then the people are relaxed because the release of oxytocin, for instance, okay? And therefore, those techniques that we use in the general osteopathic treatment are, as I said, not new. So it was just brought straight from the US with Little John, and Wernham promoted very, very well, keeping all the philosophy behind it. And this is the big danger of the GOT, is that if you don't have the real philosophy behind it, if you don't understand the principle and the physiology of the body, it will be useless, right? It will be just a technique, not a treatment, just a sum of technique, and might be totally or show a different response. Would be interesting to see a neurophysiological action of a GOT. I mean, the proper way to do it compared to another GOT example, and see what it does or not, right? So it is very important to keep in mind the philosophy of the GOT, you know, as the adjustment of the different part of the body in relation of the postural element of the body as a whole, right? And because the osteopathic lesion is physiological, is not anatomical. So we have to think about physiology. Physiology. We have to think about how can we measure it, right? So, and therefore, I mean, we can promote it and we can rehabilitate it, right? So this is a good point. And what about the GOT scientific background? Actually, not that much, not that much. So we use osteopathic techniques in more than a century, right? There is very little scientific evidence to support the use or not of the GOT. And this is in danger, because if there is no research supporting its use, why should we use it, right? Why should we use it? So several and very few, let's say, not very well-powered studies assess the GOT by itself, or compare the GOT with other osteopathic manipulative treatment technique, right? Like in this study when was it? It was just 50 patients. It's not that much, but and it was quite recent. It was in 2018, you know, 2 years ago, let's say. They compared the GOT with other osteopathic technique like high velocity thrust muscles energy technique, myofascial release, or cranial visceral technique. And they found that the GOT was beneficial, at least as other one, not more or less, but at least as other one. So it's a good point, right? In patients suffering from fibromyalgia. Another study, it was in, it was 2014. So with it was a randomized study with control group, with only 34 participants. show that osteopathic intervention using articular and soft tissue mobilization, including the GOT, was effective. So it was not the GOT, it was some technique included in the GOT, was effective on patients suffering from anxiety and also on global body perception in asymptomatic female students. Another one show about the association of the general osteopathic treatment and the postural change, right? In LT subject or with patients suffering with mild idiopathic back pain. But again, there are small studies. The power of the studies might be not that strong, right? And well designed, but let's say it's quite a start now. And so we know also that the three consecutive osteopathic manipulation based on partial GOT technique. Again, partial, why not complete technique, but not treatment, right? Well, at least give some positive results on posture control, right? And several research conducted in Russia report encouraging results affecting the GOT on neurotic states in women, asthmatic children, and on patients suffering from chronic tension type headache. Some very few studies, they fail to demonstrate the positive effect on GOT, for instance, on lumbar rigidity coefficient. But again, here, we have poor homogeneities of the studies and mainly subjective outcome assessed. What about the objective one, you know? So methodology and power is very questionable there. And that's why it's a very urgent need. It's very urgent need to promote research on the general osteopathic treatment, because it was done before. It was used in the States before. It was abandoned because maybe they didn't really understand the effect, and it was an easy way to do without thinking of what to do precisely on the body structure and how it affects the body function. At that time, few studies were available. Then people prefer using the steel technique or myofascial technique, then cranial technique, then visceral technique, general or specific. And nobody talk about the general osteopathic treatment again, although I'm pretty sure that every school, college teach it. I don't know who teach it and what is the rationale behind this teaching. What is the philosophy that they want to pass along the GOT? So the GOT is just a powerful, wonderful tool because it's treating a person, right? And we try to work on these three pillars of Littlejohn, you know, the structure, the function, the environment, and try to adjust the mechanics related to the posture. And we have several very important neurophysiological effects that in 2021 are still very unknown and need to discover much more for that. So this was the goal of this this study, is to really point out the effect. What is the general osteopathic treatment? You know, just to say that osteopathy is not bony adjustment, but it is body adjustment. So if you think about that, the general osteopathic treatment makes sense, right? Because it's not body adjustment, bony adjustment. Because if it was bony adjustments, I mean, we can call ourselves physiotherapist specialized in manipulation, or chiropractor, or whatever. So this makes the difference between practice, technique, right, and an art and a science. So therefore a medicine. And this is the big threat for osteopathy, the very big threat, that it will not come anymore an art and a science, and therefore a medicine, even if they call it medicine in the States, right? How many osteopaths in the States practice osteopathy according to the principle? You know, I understand that the philosophy might evolve a bit, but the original philosophy, why to change it? Because it's just that, like Core said, treat a person, and we have everything in our tools. Even though we can use older technique, you know, supportive treatment, it is not forbidden. It is not forbidden to associate osteopathic treatment with Chinese acupuncture. They are complementary. It is not forbidden to associate osteopathic treatment to other therapy, like, I don't know, massage can help. Also, I'm doing vagus nerve stimulation that help in different means, right? Electrically, but also naturally. So educating the patient is very, very important. It's very part of the job, right? And this should be our routine of treating this person and as an individual, and try to balance, and if we are lucky, try to restore the physiology, right? So, but we need a very clear consensus on the education, because otherwise osteopathy will just die, and osteopathy will be just technique, right? It was just a recent study about osteopathic manipulative technique done by two French osteopaths, published in the journal American, JAMA, General American Medicine Journal, and showed that osteopathic manipulative technique is useless in case of patients suffering from chronic back pain. So this is very dangerous, right? Because if you say osteopathic technique is useless, then you can say osteopathy is useless, but osteopathy is not technique, okay? So this is very well that need to be understood. And again, I pointed here the very urge need to do research, and very well research linked with the classical general osteopathic treatment. Okay, and there is a lot of literature about it. There is a lot of book, Wernham, One-Man, Campbell, Chris Batten, and others. They wrote a lot about that, right? But those are scholar books. Those are institution books, right? And chapters. So we really need to promote beyond the ICO, beyond the school. We need to promote with professional osteopath, classical osteopath, traditional osteopath, I would say, this research to hopefully we can save it. Because as I said in the beginning, prior to this talk, if the ICO die for whatever reason tomorrow, the general osteopathic treatment philosophy and and all its contents and all Wernham work, right? Little John is done. Who teach Little John anywhere in osteopathic college here, right? So maybe the first year, second year is about a philosophy and principle, and that's it. Okay. In the ICO, it's every day, it's every day, it's every day, because you have to tap on the nail that it gets into the wall, and it's constant learning about the anatomy and the physiology all the time. So, and by doing research to understand the underlying mechanism, because it is nice to say, yeah, this is to convert mechanical input into a physiological equivalent, okay? But prove it. Show me what physiological it does. And we have literature already, right? In the earlier osteopath, the spreading pump or the technique help people suffering from immune disease or diabetes, right? For instance. So we have the tools for it. And the GIT, which also is very rich in neuroimmune cells and macrophage, the heart, the lungs, the liver, right? They are all over, and the skin. So we touch, I mean, a pure living plasticity body. So we can reverse perversion. Gene can mutate in a way or in another way, right? They can express badly or they can express afterwards in a normal way, because this is called neuroplasticity. So let's say that the general osteopathic treatment encourage and induce physiological plasticity mechanism in the body to try to balance the body homeostasis. That's what we learn. And what is body homeostasis? Is when we have a very good balance between of the autonomic nervous system that can be shown easily by heart rate variability, which is quite a stupid exam that takes 10 minutes to do. It's not very expensive. It's cost less than an osteopathic treatment table, right? And it can be done at any practice. So we definitely need more evidence to support the general osteopathic treatment. And this was the idea of this research, because, you know, every osteopathic manipulative treatment or technique, they are part of this glossary, American glossary, but not the GOT. And why, right? So it's very important to educate people and to make them very aware that if we don't do something, we will lose it. And if we lose it, we will lose everything, right? And osteopathy will be just resume in a technique or some technique. No, we have people calling themselves osteopathic therapist or other name like this. Doesn't make any sense. And they promote teaching this, but what they did is just promote teaching bloody technique that everybody can copy and paste, right? So this doesn't mean anything about osteopathy. So technique is not osteopathy, and osteopath is not osteopathy. So this would be my conclusion, that we have to give back to Caesar what belonged to Caesar. Means that osteopathy is an art and science, right? Of of manual medicine or alternative medicine, of medicine, just that's it. It's another way of treating patient than giving drugs, or the Chinese medicine that stimulating with needles in the body, right? So that's what need to be promoted. The general osteopathic philosophy of treatment, the very traditional one, and then promote the research to support its use and spread the results, and then we can save it, and maybe we can teach it in the way it should be taught. As far as I know, only through the ICO it is done, and for other people who have the chance to be taught by John Wernham, who saved it and who understood very, very well what it does mean, right? So this is important to understand what it does mean. So if you have any question about this, please, welcome.
Hi, Pascal. Thank you very much for your lecture and all your information and great words. Yes, if anybody has got any questions, please send them to Pascal through the chat box, and we will read them out to him.
Hi, Pascal. That was really interesting. Do you think that it would be useful if the general osteopathic technique was listed by Ecop, the ECOP?
I believe after it's a good question, because we don't know what would be the we can expect from that, but at least it could. There are some US osteopaths. They treat a patient in a osteopathic way, right? Some of them, they don't give medicine, and they are very aware of the classical medical system. So it could be useful for them to use it because it's just a powerful tool. You don't need specific adjustment to show evidence of physiological response. And it's very safe. You can do it to babies, you can do it to elderly people, I mean, everybody, right? And you will show physiological response in a positive way. So I think it would be very good to reintegrate the GOT where it came from at the origin. So it was not Little John, it was still then others, and then he just died because he was not promoted in the States, because he was not really understood, and maybe Little John understood it better than the other one, I don't know, but they are not interested about it because maybe they don't understand what is really behind that, and so they lose it. And hopefully it came to UK, and hopefully you guys are there, but because otherwise, the GOT, when I went teaching in Montreal, I taught the GOT to a GOT professor there, and it was not the same that my GOT, I mean the traditional, let's call it like this, nothing to do with what they do, just nothing to do.
That's I think that is one of the problems in a lot of the undergraduate colleges. They teach what they call GOT, but it isn't what we teach as a GOT. I think a lot of the undergraduate colleges or other places that teach GOT, it means it's a general articulation of everything, rather than an integrated kind of treatment of the person and using their anatomy to affect their physiology by trying to improve integration of their arch mechanics and the autonomic nervous system.
I totally agree. It should be like this, but it's not it is taught at, elsewhere, right? And therefore they are not interested. They are interested in bony adjustment.
Yeah.
But they are not interested in body adjustment.
Well, that's why we moved away from general osteopathic treatment to body adjustment. But unfortunately, some of the other colleges now call what their GOT body adjustment, but they don't teach the physiology behind it and the depth of understanding, the osteopathic thinking, you know, the principles behind it. You know, it's taught as an adjunctive technique, which, as you say, it makes it very limited in its capacity to do anything. That's not what it's for.
Yeah, but you know, Wernham said, whatever you name it, actually it's not about the name, right? It was called General Osteopathic Treatment at the time of Steele and early in the States at the time. It's treatment, but the problem with the GOT is that it can be perverted from treatment to technique, right? That's why adjustment, it's a better word because you cannot mistake it for technique, all right? GOT is treatment, it's not a technique, right? It includes technique and procedures, right? But yeah, and it needs to be taught, and whatever the name, just to what it was supposed to be. But again, I think that what we pointed out in this review is that there is lacking of evidence, lacking of research to support it. Because if we don't do it, we really might lose it. Because, you know, what's changed between now and before is that we are asked, as an osteopath or any other medical practitioner, to give evidence, to show evidence of what we do for the safety regulation of the profession, right? As you know, osteopathy is mainly unregulated through the world, right? And the way it will be regulated will be with evidence, but those evidence should serve the profession and not the opposite. And the study, they just was 2 months ago from France, right? I mean, from osteopath doing osteopathic technique and then show evidence the osteopathic technique doesn't work. But to me, it's nothing to do with osteopathy.
No, that's right. It isn't. You know, it's demonstrating a manual technique on an individual without any sort of thought process behind it. That's not osteopathy.
No.
All right. That's been fascinating, Pascal. Thank you so much for coming on and talking to us about that. It's really interesting. And this paper's out in the American Academy of Osteopathy, the Journal of the American Academy of Osteopathy in June, is it?
Yeah, I hope so, in June.
Who were the writers, the authors?
So it was myself, Tim Sparrow, and Francois Lalonde. Francois Lalonde is an osteopath and a PhD.
Okay.
So yeah.
Thank you very much, Pascal. It's been fantastic listening to you.
Welcome.
Yes, thank you very much.
With pleasure.
Yes. Well, some people are asking he came across some osteopaths that trained with John Wenham back in the 70s and 80s, and they say that the ICO isn't the same thing nowadays. So where do you get or become a real classical osteopath? Yeah.
Or I become?
A real classical osteopath.
Well, I become a classical osteopath because I was lucky. I was very lucky. I choose the right college, right? I'm not sure if I've been to the European school, right? It would have been the same. And because with Wernham, it was every day, every single day, I mean, we were fed up about the GOT because it was always. But at the end, we started to understand what it is meant for.
But I suppose you cover GOT from the physiological aspect as well, not just pure technique, as you were saying. It's the understanding behind or reasoning behind what you are trying to do with your hands.
But exactly, that's what Mervyn Wallman showed very nicely in his lecture and video. Right? It's just an art, and Chris same, right? And that's all it should be taught and keep taught. But again, we stress out the importance to have more evidence, right, to demonstrate the physiological effect of the general osteopathic treatment.
I have my experience in Spain with a lot of students, undergraduate students, that they had to do this thesis or little project, and they always want to do a project on GOT, and we all find very difficult to pinpoint, the whole aspect of the GOT, because there are so many things that come into a treatment. It's not like you do sub-occipital inhibition. I find it difficult to research, I suppose, with so many variabilities, I would say.
Yeah, but of course, you target many different systems, right? You target the lymphatic, you target the vascular, you target the neurological system. When you do research, you have to target something, right? To be very precise and say, okay, I want to analyze the effect of the GOT on the autonomic nervous system. Just that's it, right? So what will I use to measure it? You have different way. You can measure the blood pressure, you can heart rate, you can measure the breathing rate, right? But this is not very accurate because you can have an idea of the sympathovagal balance, but you don't have what is part of what is sympathetic, what is parasympathetic. The best is the heart rate variability analysis so far, because it's so deep that we can also assess with this what it does. It means in the physiology, the neurophysiological connection into the brain. What does it mean, right? And therefore, you can use the GOT for people suffering from depression, anxiety, PTSD, concussion, because of the underlying effect on the autonomic nervous system balance. You can do the same after, but you need to have tools and to investigate the effect on organ perfusion, right? There are different means. You can check, what's the influence on the level of inflammation in the body by what blood work and immunoassay, assessing the level of some inflammatory pro-cytokine in the blood. So you have different means to approach it, but very possible.
Yes, I do agree, and I'm very happy that you are saying this, because I think you made it very clear how many different types of research and approaches to this research that we have. And you know, obviously we have team Sparrow nearby, and I'm very pleased that he's doing all this work along
Yeah.
with you, because he can help us a lot. And I agree, if we don't carry on this research and explain people why we do what we do, then maybe in the future people will say, oh, we'll stop doing it because there is no evidence of.
Yeah.
So this is how the world is going at the moment, the osteopathic world.
Yeah. Plus also the problem is money, and because to do research you need money, right?
Yes.
So either the ICO is very, very rich and can have its own lab and blah, 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 or you have to make collaboration with university departments. Here I'm writing a paper with a guy from the Faculty of Medicine of university in Madrid. So, and I'm here in Canada, he's there in Madrid, and we work on the same paper. So it is possible. But when you have to do lab and something like this, either you have the tools, right? Otherwise, you create a research department. Doesn't need to be big, right? But with some basics tool, you can start doing some stuff.
Yeah, totally agree with you, Pascal. And yes, I do agree. So we need people coming into the ICO and make some funding for proper interesting research on GOT. Which
yeah, and I know that Tim is trying to fighting to go into the same direction.
Yeah. Yes. Yeah. It's well. There are some comments at the back. Tim, he's saying he was a student in the 80s, Tim Sparrow. For me, the course was evolved in the context of the ideas that John Wennon encouraged from all the faculty members of the ICO, Mervyn Waldman and Chris Campbell, examples of this, yeah. So it was a time when the 80s and 90s where Mervyn Waldman and Chris Campbell and John Wennon were in the John Wennon College. And obviously, we don't have the lack of having all of them now at the same time in the same place. So we have to take them by bits, which is this way.
Yeah, you see, there you go. You said we don't teach GOT, it's body adjustment. It's just the same.
Yes, yeah. I think that was me. Yeah, that was the idea.
Yeah. Same. But what you don't teach is general osteopathic technique. No, you teach general osteopathic treatment. You treat a person, general osteopathic treatment, right? After, when I'm called it body adjustment, but it's exactly the same.
Yes.
The procedure is the same. It's just another synonym for it. But the GOT, because in France they use it the TGO, right?
TGO, yes.
See, that's why it's for them it's easy. But if they use the TOG with this treatment TOG or GOT, TOG, traitement osteopathique général. It could be also technique. So the T is something that could be dangerous. There is no confusion with the body adjustment.
Yes. So some people call now total body adjustment and body adjustment routine. I don't know, different names. I agree. sometimes we get lost in names, and we don't need to get lost in names. It's just
you don't have to reinvent the wheel.
Exactly.
The body adjustment is good, because if you add routine, if you add routine could be boring.
Yes.
You know, and because it's not a routine, because you don't do the same to every patient, right?
That's
routine
right.
is something that is repetitive, always. Yes, the philosophy is a routine, right? The concept is a routine. The way you will do it is quite a routine, but if you use it as a routine, it might be boring just because of the world.
Yeah, the way we are now at the moment at the ICO, obviously we have a strong interaction, obviously with Mervyn Waldman and Chris Campbell, which are kind of the senior leaders of the ICO. And I like when they talk about body adjustment to the cranial bone, for example. You know, it's not always that you have to do the whole routine because of the vitality of the patient.
Exactly.
And that's what we're trying to come across to the students, that body adjustment can be a suboccipital inhibition, or could be just a full treatment. But yes, it's difficult to explain that in 1 hour lecture. But I think we agree on,
Yeah.
But no, it's very good. It's a lot of people chatting and saying hello. I think thank you very much for the talk. A lot of people asking, about the studies that you are going to have in the journal, and so a lot of chatting behind the screens.
Yeah. So when the study will be, the paper will be published, you will know about that.
Yes. Please. We have a little in the website of the ICO. We have a little section with papers and so on that we normally publish. I suppose this will have to be released under certain aspects, but happy to introduce that. Pascal, are you in Hamburg in June?
Yes, I will be in Hamburg in June.
Okay. Yes, you will be there. If things go well, or I don't know, if we are allowed to fly, or...
In June, yes.
Yes? Okay. Fingers crossed. I don't know.
Who is the situation in UK?
In the UK, I don't know, but I live in Spain. In Spain, there are still some restrictions everywhere. But we are allowed to teach at universities, so I don't know.
It's tricky in the UK at the moment. We have this red light system, and some places you have to fly into and do 14 days quarantine, and then when you get to your destination, you have to do 14 days quarantine in a hotel at your own expense.
Yeah.
So
it's the moment, right? Yeah. But in June, hopefully, it will be better.
Yeah.
And, and I got vaccinated, so the first shot, the English vaccine. Yeah. So far, so good. So we have to flat the curve, and because it's just crazy.
Very good. If we don't have any more questions, I'm very pleased that we have such a big interaction of people talking and.
So I will be pleased to come and speak to the CEO at the ESO. I don't know who is the CEO there now.
Sorry?
What is please come and speak to the CEO at the ESO at Maidstone. I don't know who is the CEO there.
I don't know now.
Ian Fraser. I don't know.
I know the ESO linked to another university in the UK, and a little bit, don't follow very much nowadays. But yes, it would be nice. Even it should be taught at the British School of Osteopathy or UCO, as it's called now. but we never had the kind of body adjustment general treatment at the BSO. It was never taught by no means.
Really?
No, not at all. No, introduced a little bit, nothing. Only introduced as a students in Manus Sinestra by John Bueno, and that was it.
So, who will teach it?
Who will teach it?
Yeah, at the BSO.
Nowadays, I don't know. No, nobody taught that. So I don't know what they teach now. I suppose they are very much into a structural technique and research based. But as you were saying, you explained that very well. I mean, research doesn't mean you have to crack a bone to research. And
become, yeah. You know, it's very political. You know, become ESO merged. The CEO is not an osteopath. This is just money business, and this is very, very crazy. But what I want to say again is that the general osteopathic treatment includes both. It's not separate. Includes both general techniques, articulatory techniques, soft tissue techniques, pumping techniques, oscillatory technique. They all have neurophysiological effects, but it includes as well specific technique. We do specific treatment, we do specific adjustment relate to the general osteopathic treatment. I mean, which is a package of general and specific.
Yeah. And the use of long lever, I suppose it makes a difference that some people don't know how to use the long lever, or they think it is dangerous to use in patients. And the articulation behind the technique, which has been lost at the moment, I think, in the teaching of techniques. Yeah. So I think, it's a lot of chatting behind the screen. But anyway, I think we can leave it there. If you are happy with this, we don't have any more questions. Thank you again, Pascal, for being here. And you know, once the research has been published, maybe we can have another chat another time later this year, or something like that.
Sure.
Yeah. Okay, Robert, over there, you were chatting.
Yeah. I just wanted to say, for those people who've been asking about training to be in classical osteopathy, please do go to our website, which is www.classical-osteopathy.org, where we have information about our 2-year course training and how to train to become or start your education and become a classical osteopath.
Fantastic. And then we can fund some money for research for Pascal and team and so on. It will be great to have your ideas behind and
because it's not that difficult, and it's not that difficult. You don't need a lot of stuff. With the new tools, validate. It's like heart rate variability analysis based on EKG. It's very, very effective, very easy, very simple, and it shows a lot. It's because we are all regulated by the autonomic nervous system. You know, the vagus nerve on itself modulates almost 80% of the total volume of the brain. So the vagus nerve. So if this is the brain, this is 100%. So all the volume, the vagus nerve modulates all this, and specifically in the limbic system, right? Or we process the emotion and so on, and also visceral information. So it's very powerful, and so it's very easy mean, and could be done. And I would say it should be done, because we need more research again to promote and to defend our original traditional osteopathic treatment.
That's correct, and we agree with that. Yeah. Thank you very much, Pascal.
Thank you
for your time,
everybody. Thank you, Diego, for organizing that. Thank you, Robert.
Yes, and we keep in touch then.
And
yeah, and say goodbye to everybody who just still listening. And I hope we don't have any more webinars planned just at the moment, but I'm sure we will come with new speakers either in May or June. Okay, good evening.
Good evening. Stay safe, everybody. Bye, Diego.
Bye-bye.
Ciao.
Ciao.